Greetings again. Today we have MEC Group and ESKAGA Tennis. We are going to discuss vaccination. I noticed that many people are confused whether to vaccinate or not. In our studio today, we have Professor Komal. Please welcome.
Thank you, Mr. Kaka.
And human rights guru, Ntate Benito Mutitswe.
Thank you, Mr. Kaka.
Yes, thank you very much. I'm going to start. They can decide who is going to answer first. Is it necessary, doctor, to vaccinate? Because there are so many stories. Some people are saying, no, if you vaccinate, you will not be able to do something that you used to do before, which are medically rumors, which is not correct. Yes.
Yes. I think a lot of uncertainty, Mr. Kaka, comes from the principle of people are worried about the unknown. Then there are those who are obviously spreading a lot of, we call it pseudoscience, which says the vaccine doesn't work, there's other agendas, they're putting chips in you. And based on the current evidence we have, I think it's a whole lot of nonsense. There is good reason to have concerns, yes. Can somebody have an adverse reaction? The answer is yes. But not just to the vaccine. If someone is predisposed to healthcare concerns, if someone is predisposed to significant healthcare issues that didn't exist previously, there's a very high likelihood that this concern they have exists without the vaccine. Based on the current evidence and science that we have, the vaccine is the only option that we have right now, besides social distancing, wearing masks, sanitizing regularly, to reduce the pandemic and beat this pandemic and the various waves and the different variants. It's simple. The only solution we have that's been proven, irrelevant of the brand, vaccinations prepare your body for an anticipated infection. And I saw a really nice cartoon yesterday, and it was very true. Essentially, you create a fake inflammation to your body. Or if I use a militaristic example, you create a fake attack on your body. You activate your army and your defense systems, only for the body to then realize it's not a genuine one. But the body doesn't know that. It's reacted, it's ready, it's on standby. But outside of the body being ready from an immune system, you have memory cells and other complex issues of your immune system, of how it works. But the body builds a readiness because it's been pre-exposed. And that readiness you're not aware of. That pre-exposure, that memory that the body does automatically is not part of what you need to cognitively be aware of. But the body has that and stores that in its memory. So when you do get an infection, the body says, I know how to deal with this. That is what is important from the vaccine perspective, irrelevant of which form of vaccine you take. That's the principle behind all vaccinations. The body's been pre-primed to protect itself. How long it lasts, we don't know. There's talk of booster doses, but there also talks of when you took yellow fever in the old days. You must take it once in 10 years. When the company realized they're short of stock and there's not enough to go around, no, once in a life is okay. So a lot of the decisions of whether to take a booster or not is not always science. It's availability. If we call it the North is now already looking at exposure for booster doses. The South and most of Africa and the developing world have barely got the first dose, let alone complete vaccination. And that is a critical concern. But based on the science we have right now, I've made the decision, so has my family. My mother's had a heart bypass. She has significant health concerns. If it becomes available for children, I will probably make an informed decision. But based on the evidence we have, it appears to be perfectly safe. Again, what is the alternative? Because please, what we need to clarify is when we talk about taking the vaccine, it's not to not allow you to get COVID. No, that's not what it's for. It's there to reduce mortality, i.e. reducing your chance of dying, to put it simply. And secondly, to reduce serious illness. So the vaccine, based on what we understand, will reduce the chances of whether you recover from getting COVID at home or you're ventilated in an ICU and your chances of recovery is lower. That's all it does. It does not stop you getting COVID. You're not immune. So hence this misnomer in industries of immunity passports is dangerous. You're not immune. You're just less likely to die. And if the choice is between living and getting close, if not dying, then it's an easy choice given the choices we have right now. The vaccine, I've personally taken it, a lot of my medical colleagues have taken it, and I haven't found a comprehensively well-informed divergent view based on science that says, don't take it.
Wow, this is very, very powerful. So, Mr. Benito Mutitswe, the doctor said this is the only thing that we have to, not necessarily to prevent COVID, from attacking us. Because from a legal point of view, I used to think that to take vaccine it means I am scotch-free now. But I just realized now that it's not a prevention. I have taken a vaccine myself and my entire family as well, excluding kids. So I wanted to know from Mr. Benito, as an attorney, I've realized that some of the employers, they are forcing people to take vaccine. Can they do that in South Africa to protect us who have already taken vaccine?
Well, again, thanks. I think Prof is really helping us to clarify a lot of issues about vaccination and COVID-19. And I want to thank you for that, Prof. Dr. Kaka, as I said in different platforms with you about this, it's not an easy matter. And it's true, it's the only solution at the moment. But so what do you do? For me, I think let's persuade people. Let's find a way to persuade more people to understand what Prof is explaining. That it's not a cure. We have not found a cure, but this is the only thing we have. How do we take advantage and save lives and reduce mortality, as Prof explained? For me, we need to persuade more people to take vaccines. I'm going. I'm ready myself to go very soon. I know my wife is going this week. But I think the point I want to really emphasize, to build on what Prof explained, is that we need to persuade people. You need to find a way. I know there are people who are giving you, you can enter, if you're vaccinated, you can get a 5 rand extra, you can get this extras, points or whatever. That kind of a campaign can help us. What we have not done, especially in South Africa in the last 27 years, is civic education about all these things. Whether it's election, politics, people hate politics. People will hate vaccination because there's no civic effort. Remember, our people are not literate. We undermine the fact that millions of our people are still illiterate about a lot of things. Now, with COVID, it's more complicated. Even doctors and scientists are still grappling with what it really means. What is it?
Yes.
Where are they literate in the scope, in the landscape? They know where. Now, if you leave out civic education about diseases, about, like you leave it about election and politics, people will hate it, will not understand what it means, what it takes, what their contribution must be or could be in the whole discourse. So I think we need some health education, some public education about health on an ongoing basis. So there's lots of diseases that people know but they don't understand. Now, COVID, if we still have to ask doctors and they themselves are grappling with COVID and vaccination, we must not expect the majority of people who are illiterate to come on board. But let's persuade them, let's educate them so that they understand the implications of COVID, the implications of vaccinating or not vaccinating. So mine is really to say it's not a legal issue per se. It's a science issue. Prof says less of, not so much science, but we're grappling with a medical issue here, which requires scientific, a lot of scientific information and understanding. The laws are clear, the rights are there, people have the rights, but the rights are limited. So your rights cannot supersede my rights. The only right that is inherent is the right to dignity. And therefore you protect the dignity of others by protecting your own dignity. And that's, I think, for me, fundamental.
Wow. The rights are limited. I want us to take just a short break so we'll come back again. Thanks.